Hello and welcome. Today we're diving into a serious and relatively rare condition, bladder necrosis. We'll explore what it is, what causes it, and how it's managed. It's important to note that bladder necrosis is a severe medical issue, and any concerns about your urinary health should always be discussed with a qualified medical professional. Bladder necrosis, as the name suggests, is the death of bladder tissue. The most common cause is ischemia, which means insufficient blood supply to the bladder. This can be triggered by a number of factors. Prolonged bladder distension, for example, where the bladder is stretched far beyond its normal capacity for an extended period, can compress blood vessels and cut off circulation. Pelvic surgeries, especially those involving extensive manipulation of the surrounding tissues, can inadvertently damage the blood vessels supplying the bladder. Other potential causes include severe pelvic infections, radiation therapy to the pelvic region, and conditions that cause significant blood clotting disorders. The pathophysiology of bladder necrosis is essentially a cascade of events triggered by the lack of oxygen and nutrients reaching the bladder cells. When the blood supply is compromised, the cells become starved. This leads to cellular dysfunction, followed by cell injury and ultimately, cell death. As necrosis progresses, the structural integrity of the bladder wall weakens. This can lead to complications such as bladder perforation, where a hole develops in the bladder wall, or the release of necrotic tissue and infectious material into the surrounding tissues. The body's inflammatory response to this damage further exacerbates the situation. Bladder necrosis is considered a rare condition. Precise epidemiological data is difficult to obtain due to its varied causes and the fact that it often arises as a complication of other medical conditions. It is more commonly seen in individuals who have undergone extensive pelvic surgeries, have a history of pelvic radiation, or have pre-existing conditions that compromise blood flow. Specific age or gender predilections are not well established, as its occurrence is more closely tied to underlying risk factors rather than demographic characteristics. The signs and symptoms of bladder necrosis can be varied and often overlap with other urinary tract problems, which can make diagnosis challenging. Common symptoms include severe pelvic pain, which may be constant or intermittent. Patients may experience hematuria, or blood in the urine. Urinary retention, or the inability to empty the bladder, is another potential symptom. In cases of bladder perforation, symptoms can escalate rapidly to include signs of peritonitis, which is inflammation of the lining of the abdominal cavity. These symptoms include fever, abdominal rigidity, and a general feeling of being unwell. Diagnosing bladder necrosis typically involves a combination of imaging studies and direct visualization of the bladder. A cystoscopy, where a small camera is inserted into the bladder through the urethra, allows the doctor to directly examine the bladder lining for signs of necrosis, such as discoloration or tissue breakdown. Imaging studies like CT scans or MRAs can help visualize the bladder wall and surrounding tissues, identifying potential areas of necrosis or perforation. Urine cultures are often performed to rule out or identify any accompanying infections. A biopsy of the bladder tissue may be necessary to confirm the diagnosis and determine the extent of the necrosis. Bladder necrosis isn't typically classified into distinct types. It's more of a spectrum of severity, ranging from localized areas of necrosis to widespread involvement of the entire bladder wall. The extent and location of the necrosis significantly impact the treatment approach and the overall prognosis. Treatment for bladder necrosis is complex and depends heavily on the severity of the condition and the overall health of the patient. In severe cases, surgical intervention is often necessary. This may involve partial or complete cystectomy, which is the surgical removal of part or all of the bladder. Urinary diversion procedures, such as creating an ileal conduit or a continent urinary reservoir, may be necessary to allow for urine drainage after bladder removal. In some cases, less invasive procedures like transurethral resection of necrotic tissue may be possible, especially if the necrosis is limited. Antibiotics are essential to treat any associated infections. Pain management is also a critical component of care. Preventing bladder necrosis focuses on minimizing the risk factors. This includes careful surgical technique during pelvic procedures to avoid damaging blood vessels. Prompt management of urinary retention and avoiding prolonged bladder overdistension is also important. For patients undergoing pelvic radiation, careful planning and monitoring can help minimize damage to the bladder. Managing underlying conditions that increase the risk of blood clots can also play a preventative role. The prognosis for bladder necrosis depends largely on the extent of the necrosis, the underlying cause, and the patient's overall health. Early diagnosis and treatment are crucial for improving outcomes. Complications such as bladder perforation and sepsis can significantly worsen the prognosis. Research is ongoing to explore less invasive methods of treating bladder necrosis and to develop strategies for preventing its occurrence. Some recent studies are investigating the use of hyperbaric oxygen therapy to promote tissue healing in cases of ischemic bladder injury. Further research is needed to fully understand the potential benefits of these approaches. Remember, this information is for educational purposes, and you should always consult with your healthcare provider for specific medical advice.